Welcome, welcome, welcome. Facebook Live update. Colette Moses, how you doing, sister? Ella Flagger, good to see y'all. Missed you yesterday. Here we are today. Willie Christmas Smith. Mo said so. Carla Hicks. Deidre Melton, Simplified, wasn't number one today. Sharon Barner Brown, Tanya Fowles. Y'all don't know who this is. Habib Salam, peace, peace. Mozak Barnes, good evening, brother. Hold the line. Doris Daniels. Alice Thomas, bless you. Bless that South Ford over there. Diane Smith. Donna Sellers, Wanda Ralph Harrison, Jamar Singleton, Joyce Daly Hargrove, Denise Urban, Mike Missy. How you doing, my brother? April Scales, Isabel Cruz. Yes, yes. Adelia McElroy, good to see you. Blessed, Colette. Tahisha Creedle. Put that mask on, Alice. Latanya Green Chan, Mary, May Tunley, Eunice Busby. How you doing, Mary? I think this might be your first time. Siobhan Armstrong, at least the first time for you shouting you out. Tanisha Coleman, Stephanie Holmes Turner, Charmaine Mark, Kathy Michelle, Karina Pereira. How are you? Evelyn Velez, Sandra Drayton, Layla Lespia, Renee Holman, Lorraine Heyman, Sam Young, Teresa Smith. Hold on, y'all. Hold on. Miss Ali, the Haviland Kitchen, Taisha Miles, L. Monique Williams, Karima Norman, Salima, Imani Bay, Diab Abdul Salam. Peace, bruh. Deborah Smith Gregory. Thank you. Good evening, good evening, good evening. I got a little rest. Thank God for that. Carol Green, Benicia Talaferro, Karima Muhammad Harris, Queen B. Moore. Good evening, good evening. Gloria Anderson, Tamika Darden, Susanna Melo. Thank God for that. I'm glad you had a good, successful day. Golden Child, Sharon Lynn Flo, Joe, Esther Chambly, Robert Cole, May Newsom, Cinnamon Buns, Elise Pure Ford, Primera Iglesia, Getsemani. Hope I said that right. Terry Hurd, how you doing? Cindy Bell Pinkney, Michelle Carberry, Brenda Yvette Brown, Monica Green. Nobody told me who this was yet. Sharon Tompkins, Hesseray Cobb, Nefer Ra. Hold the line. I love saying that. Hold the line. Henrietta Harris. The end of a thing is better than its beginning. The patient in spirit is better than the proud in spirit. You better believe that. Thank you for that, Henrietta. Nefer Ra, too mighty Ra. Peace, peace, peace. Thank you. Need the light, all the light I can get. Cynthia Wall, Cott. God bless you. God bless you. Linda Barge, God bless you. Dory Negroni, how are you? Thank you. Louis Scott Roundtree. Maribel Santos Ayala, good evening to you. Ardelia McElroy, Central Board. Nicole Brown, Val Brown, how are you? How's everything? Lejeune Cooney Green, Sandra Sanders Hall, Robin Latif, Wardell Mitchell, Monica Green. No one still told me who this is. Patricia Bradford, how you doing, Pat Bradford? Holding down that West Ford. How's everything up there? Carol Green, Marcella Mitchell Lamar, Kia Teller, Mike Emmanuel, Shalise Fuller, Shirley Danberville, Diane Murray. That's right, Diane. Sounds of blackness. Sounds of blackness. Gladys Santana. Happy birthday, Gladys Santana. Happy birthday, and a happy birthday to you. Leslie Foster, Veronica Bowie. All politics are local in the building. WRNU Radio. Darlene Nash Mathis, Charmaine Mark, Donna Messier Moore, Tawana Dowdell Sure, Nilda Ortiz, Robin Cornegay, Tanya Bay, okay, Street Sweeper. I hope the folks are on. You can hear what's going on up there. Please take care of that on Isabella Avenue. Kim Barnes, Joel Daniels, how you doing? How you doing? Yeah, that was Sounds of Blackness. Hold on. Al Tariq Anque, hold the line, brother. Hold the line. Deborah Bailey Johnson, Corey Lewis, Albert Lewis, victory, victory, and more victory. Leslie Satterfield, Quab Mitchell, Timothy May, Bernard Clark. He shouts you out too, Momo. He love you. He love you. He's shouting you out too. Kiana Flowers already. Diane Murray, rest in peace. Roger Troutman, rest in peace. Rest in peace. Thank you, Jacqueline Long. Thank you. I've been in the sun. Thank you, Saida O'Brien, Rose Creech, Karen Holm, Monroe Johnson, Bridget Butler. Hold the line. Hold the line. Hold the line. Good evening. Here's our buddy, our friend, nonstop, ready to go. Ready to go, nonstop. Sharon Fleming, Nat Irvin, Monica Green, Stephanie Smith, Tawana Lobo, Kim Loyal. You know, people. Stephanie Portista, Portista Freight. I hope I said that right. Anthony Parmley, Gary Powell. Let me get to these numbers. Listen, y'all. You know that there's a change now in when we're going to do this. Some people might get upset. Our good buddy G, he might get upset. We only going to do it Monday, Wednesday, and Friday from now on. Monday, Wednesday, and Friday. And on Wednesdays, we're going to have special guests. I might even let a few people take over the live that day. Organizations or individuals take over the live and push what they want to push, but at the same time, tell us the information as it relates to COVID-19. So Monday, Wednesday, and Friday, I couldn't do Monday, unfortunately. So I'm on today on Tuesday. I'll be on tomorrow, Wednesday, and then again Friday. So those are the days we're going to go with Monday, Wednesday, and Friday. Friday is our big day. We always give the zip code numbers plus our relationship to the state that day. It's more important now than ever since everything is opening back up inside. You can go to the movies. You can go to the theater, live theater. You can go inside a restaurant. You can do all kinds of things with 25% of the capacity, but you still can go inside. And so everybody needs to be careful. We need to be careful. Hotep Bashir, how you doing, brother? We need to be careful going inside these places, y'all. We really do. Make sure you wipe the surface is down. Make sure you know that the volume is big, that there's not a small volume, and that you're not in there by yourself. I mean, you're not in there with crowds and crowds of people, that you are as distant from people as you possibly can in there, and that they have ventilation, that there's some ventilation going on in there. The dry, hot air, is a petri dish for COVID-19. We need to make sure all those things are in existence in those places. And if they're not, then you need to figure out what's best for you and determine whether you want to actually be in those places or not. It's important. And I would take it seriously because it is serious. You know, there are a lot of people that are going inside. They're happy now that they get to go inside. But I want us to be careful, please. There's an article out as well that I want y'all to look at. You know, I always drop some stuff on you. There's an article that I want you to check out. It's about the coronavirus outbreak, and while COVID-19 cases are rising, deaths are falling. While the cases are rising, the deaths are falling. And you need to check that out. The title of the article is, "Why is it that while COVID-19 cases are rising, deaths continue to fall?" I'm trying to remember which paper that was in, but look at it, Google that, and you'll get to see a few things they come up with. Interesting kind of scenarios that they're coming up with. Obviously, the medicine is a little different now. The hospitals are clearer. Most people that are getting infected now are younger people because they obviously are out here doing whatever they want to do, and they don't have a high chance of death. More people are wearing their masks, all kinds of things, which is reducing the viral load. But check that article out. Happy first day of school to all the young people who started school. Happy first day of school to all of you young people who started school today. Happy first day of school. Happy first day of school. I know there might have been some issues because it's probably impossible going virtually everywhere without having issues. So it's important that you report that stuff so it can get fixed, so it can get dealt with. Report it to your principal. We need you engaged in this process, not just as a bystander. We need you engaged. If something didn't go the way, just like you should be engaged in your kids' educational process when there's in-person learning, we need you to be engaged here. All of the glitches and issues that take place, you need to report those things so we can get on it immediately, so the superintendent can get on it immediately, and whatever we can do as a city to help out, we're going to do that. And we are working on to open up immediately places for all of our essential workers to drop their kids off, those who have to go to work, It should be happening fairly soon. People that have to go to work, that the jobs are threatened, we want to make sure that your kid has a place to virtually learn. So we're going to we setting up places with the school district to make sure that that is possible, that you have all of the utensils that you need, and that you're able to do the virtual learning from a location where people know where you go to a location where you can actually get the same kind of help if you were home. So we're going to do that in conjunction with the school system, and that should be happening very, very shortly, very soon. We just need to make sure we get all our I's dotted and our T's crossed, so that we can take care of you while you take care of your babies while you are at work, in fact. So happy first day of school. Breakfast and lunch is still being given out. Breakfast and lunch we're still giving out. Breakfast and lunch is still being given out. So at schools, and this is grab and go. You can grab the lunch and breakfast there, and then you can go. Can't stay there. And it starts at 7:30 a.m. and ends at 11:30 a.m. This is breakfast and lunch locations for grab and go. So the locations are, if you live in the Central Ward, Central High School is doing it. Remember, 7:30 a.m. to 11:30. Dr. E.L. Maflad is doing it. Quitman Street School is doing it. East Ward. So let me go over to Central Ward again. Excuse me. Central High School, Dr. E.L. Maflad, and Quitman Street School. All places you can go to grab breakfast and lunch. In the East Ward, East Side High School, Hawkins Street School, and South Street School. East Side, Hawkins Street, and South Street are schools you go to grab lunch and breakfast to go as early as 7:30 a.m. You can grab that right before you get to work. North Ward, First Avenue School, McKinley Elementary School, Park Elementary School, and Rafael Hernandez Elementary School. In North Ward, First Avenue, McKinley, Park Elementary, and Rafael Hernandez. In the South Ward, we'll be at Belmont Runyon School, George Washington Carver School, Peshine Avenue School, and Weequahic High School. Again, in the South Ward, Weequahic High School, Peshine, George Washington Carver, and Belmont Runyon. In the West Ward, be at Ivy Hill Elementary School, Ivy Hill Elementary School, Mount Vernon School, Speedway Avenue, and 13th Avenue. Ivy Hill, Mount Vernon, Speedway, and 13th Avenue are schools that you could go get breakfast and lunch, 7:30 to 11:30. Make sure you are there. It's important. So I'm glad I'm seeing a lot of folks up here saying their first day went well. I've got people who've told me the opposite, but I'm so happy. It makes me feel good that people's first day went well with their children, and invariably there are going to be situations that do not go well. But we need to make sure, if that is the case, that we report that as quickly as we can so we can get it fixed, we can get it handled. But I'm so glad that people are saying that. So here are our numbers today. Since the last time you spoke to me, which was Friday, right? Which was Friday. I did it on Friday. And here we are on Tuesday. We have 23 more positive cases, which is an average of about 6 cases a day. Which is an average about 6 cases a day since the last time we checked in. Now check this out. No new deaths. No new deaths since last Wednesday. No new deaths since last Wednesday. So we're almost going for a whole nother week again tomorrow. If we have no more deaths, tomorrow we'll be at no new deaths again for a week. So we're running good on a morbidity side, which is great, which is a national trend as well. The deaths are down, but in Newark we're doing very well. 0 deaths. We want to continue that. We don't want people to perish from it. And again, and I explained it to folks the other day, the viral load that people are getting is not as robust as it was, because people are wearing their masks by the grace of God. And some people obviously don't have a mask, some people do. And so the viral load is not as robust as it is. People are still taking a lot of chances, and a lot of young people are, in fact, the young people are trending higher now than they were before, because of parties, events, games, other things that's going on. that they go to. And by the grace of God, they are not succumbing to the virus like the elders in our community. But the important thing is even that number here is lower than it could be in comparison to what's happening around the country and right now in the state of New Jersey. So in New Jersey, we have a total of 194,667 positive cases, which is 1,245 more since Friday, right? 1,245 more since Friday. You can do the math on that. Average that out for me, 1,245 since Friday, right? It's about 4 days since Friday. They're averaging at least 300 cases a day, at least 300 cases a day, at least 300 cases a day, right? So that's the normal that New Jersey has been in, so it's not alarming, it's the normal. A total of 14,213 deaths, 14,213 New Jersey residents passed away from COVID-19, which is 18 more than Friday, 18 more than Friday. Oh, I made a mistake on the ask. It's not actually 300. It's 400 cases. Actually, it's about close to 400 cases a day. Close to 400 cases a day because it's over a 3-day period, not a 4-day period. 18 more deaths than Friday. So the 18 deaths over Friday, which is about 5 deaths, close to 5 deaths. Well, it is 5 deaths a day over a 3-day period on average. Large gatherings, the hotline has been working, 973-969-1122, 973-969-1122, 973-969-1122. The hotline has been working. The hours are changed on that hotline, though, so you have to call between 4 p.m. and 12 a.m. That's when we're getting the most issues. 4 p.m. and 12 a.m. is what the new hours of the hotline is, 4 p.m. and 12 a.m. And you always could call 973-733-6000, which is our non-emergency police line. And you can report everything you want to report there, from overcrowded restaurants to any other thing. And we need you to be on the lookout for that. We need you to be on the lookout for restaurants that are overcrowded, people that are gathering, and all of those things to help us keep our numbers where they are. In fact, to stabilize our numbers, you can see we just put out a study that was done in Newark to see the drastic decrease in the positivity rate, test positivity rate, and how we balanced it out. Well, you can see flattened it very low. We want to stay that way, but we also want to go lower than that. We want to go lower than that than we are, and we have to do that by continuously making sure that folks are reporting to those numbers. Reporting to those numbers. So there are 14 days. A 14-day quarantine state list again. I'm gonna keep going over that. There's a couple of places that were removed from the list. I know some of y'all will be happy about some of those places because it's places you like to go. But here are the states that are still on the list that you need to quarantine from, and you just need to be careful. Delaware and Maryland were re-added to the list. Delaware and Maryland, Ohio were re-added to the list. Delaware, Maryland, Ohio, back up again. And that's the thing. That's why I'm struggling with us, so that we don't go up and down, up and down, up and down, that we have a steady, consistent, flat rate. West Virginia was added to the list. Now you have Alabama, Alaska, Arkansas, California, Florida, Georgia, Guam, Hawaii, Idaho, Iowa, Illinois, Indiana, Kansas, Kentucky, Louisiana, Mississippi, Minnesota, Missouri, Montana, Nebraska, Nevada, North Carolina, was just added. North Dakota, Oklahoma, South Carolina, South Dakota, Tennessee, Texas, Utah, Virginia, Wisconsin. A couple of places that were removed should make you happy. Puerto Rico was removed off the list, and so was the Virgin Islands. Puerto Rico and the Virgin Islands were removed from the quarantine list. So was Arizona removed. New Mexico was removed. Rhode Island was removed, and Washington State were also removed, right? The District of Columbia was removed as well. So these are the places that you can go now. Washington, D.C. You can go. Washington State, you can go. Rhode Island, you can go. New Mexico, you can go. Arizona, you're good to go. Virgin Islands, you're good to go. Puerto Rico, you're also good to go there. Pop-up testing sites. You know, we had to move it out of move our regular testing site from the movie theater, because now the movie theater can open up at 25% capacity. So we're moving it to Lincoln Park for the time being. Lincoln Park will be in Lincoln Park until we figure out another permanent site. We'll be at Lincoln Park, and we'll test the numbers in Lincoln Park to see if we're actually going to stay in Lincoln Park. But tomorrow we'll be at Rafael Hernandez Elementary School in the parking lot. Rafael Hernandez Elementary School parking lot tomorrow. On Friday, we'll be at Oliver Street School. On Friday, we'll be at Oliver Street School. And we'll have more pop-up site information for you tomorrow as we add more sites. But we still have our regular sites, right? There's Ann Street School that's still going on. Branchford Park Skating Rink, still happening. George Washington Carver Elementary School, still happening. Mount Pleasant Testing Site, still happening. Mount Vernon Elementary School, still happening. Wilson Avenue School, still happening. These are regular, everyday, not pop-ups. These are happening every single day from 9 a.m. to 3 p.m., 9 a.m. to 3 p.m., every single day. And the reason we do the pop-ups because everybody can't go 9 to 3. Some people have to wait till after work. So we do pop-ups for folks who have to wait till after work. Mary Eliza Mahoney Health Center, 9 to 3. St. James on Lafayette, still open. St. James on South 8th Street, still open. St. James on Martin Luther King Boulevard, still opening. Salerno Medical Associates Clinic on Roseville Avenue. Salerno on Roseville Avenue, open. University Hospital Ambulatory Care on Bergen Street. University Hospital Ambulatory Care on Bergen Street. Those places are still open. In terms of the census, we're at 48% today. We're at 48%. This is the self-count. 48% is the self-count. So I just want us to be clear. These are the numbers that we're doing ourselves. Does not count when the census takers come to your house and you fill it out that way. That's a whole nother number. We're at 48% based on our self-count. We want to get to at least 50, 51% in self-count. That's what we want to be at. We want to be there. We have good news that federal court just put a stay on Trump trying to end the count early. Doesn't mean that it's all the way over. It's a temporary stay. They have to go to court, I believe, in maybe a week or two and figure out what's going to happen. All our prayer warriors out there and all of the folks on their phone calls need to call the legislators, whatever. We need to get them to extend it back to October the 31st. It will help us out tremendously if we get them to do it October 31st, right? October the 31st. And if you do not want to open the door for people who come to your house, right? You can go to www.2020census.gov, do it yourself, 844-330-2020 for English, 844-468-2020 for Spanish, 844-474-2020 for Portuguese, 844-477-2020 for Haitian Creole. And please reach out to 5 people, man, and get them to do the census too. If each one of us reached out to 5 additional folks to get them to do their census, we would be there. We would be there. If we get 5 other people to do the census, 100%, we could get there, right? Right. So again, happy first day of school to everybody. Just want to give up our numbers. Again, our numbers, we have 23 more positive cases than we did on Friday. So that's over a 4-day period. We had about 23 positive cases over a 4-day period and no new deaths since last Wednesday. Thank God. Newark is doing pretty decent. We want to stay there. We want to go below that. Excuse me. The state is at 194,667 positive cases, which is 1,245 more cases than Friday. 12,445 cases than Friday. Oh, it is 4 days. Excuse me. I made a mistake. It is 4 days. It's not 3 days. It's 4 days. So it is a 300 a day. It's 4 days. By the grace of God, 4 days. And they have 14,213 deaths, which is 18 more than Friday, which again is a 4-day period, which is about average about 4 more deaths a day. 4 more deaths a day. About 4 more deaths a day. Yep. So make sure that you get that hotline number, 973-969-1122, 973-733-6000. Hopefully you guys have had an opportunity to check out the King's speech, The Other America, Martin Luther King speech, The Other America. Tomorrow I'm going to talk about, tomorrow I'm going to talk about that speech a little bit. So hopefully you checked it out. Martin Luther King's The Other America is on YouTube. It's on YouTube. It's on YouTube. So let me answer this. How often should you get tested, right? So I would get tested when you a bunch of reasons. If you feel sick, go get tested, right? So it's not necessary for you to get tested every week, or every 2 weeks, every month. It's not necessary for you to do that, right? It's not, especially if you're asymptomatic. If you're sick, you should get tested. If you're asymptomatic, but you were around people and you went to one of those outdoor events or cookouts, or you went to one of these places where you should quarantine when you come back. When you do things like that, then you probably should go get yourself tested out again, right? We're gonna count the numbers every time. So if you go to Maryland and they just put it back on there, if you go to Georgia or Florida and you've been hanging out, you went to eat out, you went to a party, I would get tested. You went to somebody's house and you didn't know everybody in the house and they had a dinner party, you was inside, I would go get tested, right? If you're around crowds of people for elongated periods of time, and I would say between 8 to 10 minutes, you was around these people without masks and you were close to them for long periods of time, then I would get tested as well. So there has to be a reason. I wouldn't say you randomly just go get yourself tested, right? You need to go get tested if there's a reason. And if you're asymptomatic, the only reason I would go get tested is for one of those reasons, if you're asymptomatic. If you are sick and you have symptoms, then you should get tested immediately. Immediately. That's what you should do, right? You should get tested immediately. And you don't. I don't want you to go crazy because I know it's driving people crazy. The stress level at this time is high. I know because my stress level be high, and you just have to stay focused and do what it is that you're supposed to do, right? And if you feel some kind of way, check it out. Check it out. Yep. Do what you're supposed to do. Good. There was a thing that Chuck D had on his page. I just gotta say this before I get off here. It was the bomb. The saying that he had on his page. He said, "Not all Trump supporters are racist, but it means that racism is not a deal breaker for them." What does that mean? Not all Trump supporters are racist, but it means that racism is not a deal breaker for them. Let them figure that out. God bless you. Godspeed. Make sure you check out The Other America.